Thank you all for making your way to the next in the series of the Health Informatics Forum. Building on the success of the meeting that we had in Bristol in December of last year, I'm really pleased to see another great turnout of industry experts. I'm sure it proves to be a very exciting day of interaction and open discussion, taking the opportunity to build relationships and to really start addressing specific challenges that end users face on a regular basis.
It's one of the best events that I've been to, actually, of this kind. And just reflecting on with Andrew about why it was so successful last year, I think it was a combination of the people we had in the room. So much as we do today, we've got representatives of the service, we've got representatives of national bodies, and we've got representatives of industry. So the right ingredients were and the other thing that happened is that it was highly interactive. So frankly, we couldn't shut people up. There was a lot of exchange of ideas, a lot of people expressing views, there was a lot of kind of very mature and sensible debate about some, frankly, quite difficult subjects. And it made for a very successful day.
It's been a really good event, really good for networking and learning about actually what the industry has to offer to support the NHS in taking forward better patient-focused care.
And we've had another really good day of very intelligent and mature debate from people who, frankly, are experts in their field. So for me, the day's been really successful because I've learnt a lot, made a lot of really good contacts.
I think what it's demonstrated as an event is about bringing together those key stakeholders from a wide-ranging side of the industry and that willingness to share and to learn from each other. So I think from that point of view, as an event, it's a great delivery mechanism for bringing and constructing that kind of dialogue that we see very much as benefit to all of the delegates attending.
This is the second event I've done in this series, and again, the format of having a panel rather than a death by PowerPoint is definitely the way forward. Allows for a really good interactive session, allows for good networking, you get to know who's in the audience, and I think it's definitely a way forward. People need to come here with saying, actually, this is what I'm struggling with. How can the expert people on the panel help me resolve this? And a lot of us, through discussion and sharing of what we're doing already in our practice, which I think was one of the big pluses of today's event, was we heard about some really good things that are going on. So examples of things that are already happening, not concepts, that we could share. And I think going forward we need to do a lot more of that sharing.
It's been very interactive. So being on the panel and being in the audience, we were given a very large opportunity to ask questions and be interrogated at the same time. I think the panel selection was very varied as well. So that was really, really useful.
So I guess one of the things about the event today is there's quite a buzz. So sometimes you go to conferences and actually you get quite a passive audience who are being talked to. But one of the really nice things about today is there's been a really energetic exchange of ideas and people bouncing ideas around the room in a way that's actually has made quite a creative space. So one of the things I really like about this conference is it's the energy and the energy level in the room is really different.
As soon as the first question came out, people opened up, and really within the actual session it's been great, and even outside it's even been better. So the networking and just discussing things offline has been really useful, and just meeting some of the people that have been influential in the area has been really helpful. So thank you.
I think the atmosphere is really conducive to the right level of conversation. We've got a good mix, haven't we, with clinicians, with informatics people, government people and suppliers, and that can be an easy mix sometimes, but I think the agenda is broad enough to accommodate all of those, and of course no one part of the system, if you like, can solve the challenges we've got or even identify all the opportunities. So the mix, I think, is really helpful. There's no shyness of engaging with potential suppliers taking on board what what the health services are saying. Useful, I think, and very, very constructive.
Yeah. So I've led on a couple of sessions. One was about actually how industry and provider organisations could engage with CCGs, and again the debate came along actually were CCGs ready to be engaged yet, and what the challenges were. But actually there was a big discussion. I think one of the most interesting discussions we had was about who owned the patient record, and actually it was an interesting debate. Actually it is the patients, not the CCGs, not the practices, not the people who look after, but the patients, and actually how important it was for us to make sure that patients had access to it and could control their healthcare.
See, there's certainly been developments. I think This time there's a bit more detail in the discussions. It's a lot less theoretical. Both sides have been very impressive. You know, what can happen, but also tying that with the reality of what is happening and what needs to happen. So there would be a few more specifics that we've learned about today.
The second session, which again was really good, an interactive session, was all about use of technology to make life easier to look after patients. And again, a lot of varied views, but I think the main view was actually let's become more patient-centred. So it was really good to hear colleagues from both CCGs, provider organisations and industry talk about actually how we should be coming together to provide better care for patients.
The contacts we ever made last time are here again, so it's easier to start conversations and dialogue with the people that we've met at previous events. I think that's a real benefit of something that continues and hopefully will continue into the future.